This is the femur, part of the lower limbs. This is gonna go ahead and be the fovea capitis. And then we're gonna have the head of the femur. And then this C-shaped is gonna be the neck of the femur. And then at the top right here is gonna be the greater trochanter. And then this hook is gonna go ahead and be the lesser trochanter. This spine area is gonna be the linea aspera. And then we're gonna go all the way to the bottom of the bones, which is gonna be these side parts. There's gonna be the front of the bone, and then it's gonna be the back of the bone. It's the medial condyle. And then the outer side as well is the lateral condyle. And then the interior part is gonna go ahead and be the medial epicondyle. And then this side right here is gonna be the lateral epicondyle. And actually the interior of the part of it, which is gonna be the back side, is gonna be the intercondyle fossa. And on the front of the bone, where that little ridge is on the back, on the front of it, that's gonna go ahead and be the patellar surface. And if you go back all the way to the top, you're gonna see another little ridge. It's gonna be the gluteal tuberosity. And then to finish off on it, you're gonna go to the top right here, and that's gonna be your intercondylateric crest. The way you could tell the femurs from the right and the left is gonna be the heads project medially, the patellar surface is gonna be anterior, and the condyles are gonna be posterior. So according to the way I laid them out, this is gonna be your left, and this is gonna be your right. We have here the patella. At the top is going to be the base, the bottom is the apex, and then if you flip it over, you're gonna go ahead and see the lateral facet and the medial facet. The way you could tell these two from left and right is the apex is always gonna be inferior, and when you lay it down, the lateral facet lays on the table. So shown below, this is your left and that's your right. Shown below, we have the tibia and fibula. On the tibia, at the top, you're gonna have your medial condyle and your lateral condyle, and all the way at the bottom is gonna be your medial malleolus. And in the fibula, at the top, you're gonna have the head of the fibula, and at the bottom, you're gonna have your lateral malleolus. The way you could tell a right tibia from a left tibia is the top, the proximal end is big and robust. Also, the tibial tuberosity is anterior, and the medial malleoluses are lateral to each other. And this is your left one, and this is your right one. The way you could tell the right fibula from the left fibula is that the head is gonna be triangular shaped, and the lateral malleolus is lateral. We're gonna be explaining the tarsals of the foot. You're gonna start with your talus, and then your calcaneus, your navicular, your medial cuneiform, your intermediate cuneiform, your lateral cuneiform, and finally your cuboidal. A good way to memorize this would be that tiger cubs need milk. We're gonna go over the metatarsals of the foot. You always count medially, so you're gonna have metatarsal 1, 2, 3, 4, and 5. And then phalanges of the foot are always gonna have a proximal, medial, and a distal, except for the big toe, where you're only gonna have a proximal and a distal. The way you can differentiate the right foot from the left foot is the talus is going to be the medial and superior side. The calcaneus is inferior and lateral. The hallux, also known as the big toe, is going to be medial, and your sesamoid bones are going to be on the posterior side. So if you flip the foot over, you're going to be your sesamoid bones, and this is going to be making it the right foot. So how to tell between a male and a female pelvis. Oh, female's pelvis is right here. The pelvic inlet is wider and more oval shaped, while the male's pelvis is more narrow and heart-shaped. The pubic angle for the female is greater than 90 degrees, so this is a pubic angle. And then for the male, it's less than 60 degrees. So this is the coxa, it's part of the pelvic girdle. This right here is the acetabellum. This right here, it connects to other coxa, is the pubic symphysis. This is the obturator foramen. This right here is the ilium. This part right here is the ischium. And, sorry, this is the ischium. And then this right here is the pubis. So this is the pubis. This part is the pubic tubercle. This is the pubic crest.
And then this right here is the superior pubic ramus, and then this is the inferior pubic ramus.
So this is going to be the ischium. This right here is the ischial spine. And this part right here is going to be the lesser sciatic notch. And then the ischial tuberosity is this part right here.
Okay, so we're going to tell the difference between the left and the right coxa of the pelvic girdle. The iliac fossa is anterior to the ilium, so it goes inwards and then medially. So this one would be left and this one's the right.